Vulvovaginitis, yeah, normal right? हाँ एसिडिक, बट एसिडिक 7 से नीचे है इसलिए एसिडिक, बट कंपैरेटिवली उसमें वैसे तो उसमें भी तो एसिडिक है ना, मोर देन 4.5 कहेंगे तो 7 से तो नीचे ही है, एसिडिक है, बट कंपैरेटिवली अल्कलाइन. So till all the student comes, see this MCQ, multiple answers, try to think about this, whatever your knowledge is up to now. What I am asking is painful lymphadenopathy, multiple answers, okay? herpes पढ़ा हमने, herpes में painful था, LGD, chlamydia, which cause lymphogranuloma venereum, it causes the painful lymphadenopathy. What is the another one which causes painful lymphadenopathy? No, gonorrhea. Remember, gonorrhea. It is just a first discharge from the urethra, so it is not a painful situation. Not a donovanosis, not a syphilis. It is a chancroid. Okay, it is a chancroid. So see this painless ulcer. So that was a painful lymphadenopathy. So these are the examiner's favorite question. In a clinical question, they will give you these findings: painful ulcer, painless ulcer, painful lymphadenopathy. Right? You will see many questions. Painless ulcer. What is primary chancre? Syphilis. Is syphilis painful? No. So painless is a primary chancre. What about lymphogranuloma venereum? No, its lymph node is painful, but its ulcer is painless. Okay. What about donovanosis? It is also painless. So as you can see, herpes has a painful ulcer, painful lymphadenopathy. So I can say lymphadenopathy initial episode will be painful and then later it will be painless. Chancroid painful. So यहाँ पे भी हमने बात की painful lymphadenopathy और अल्सर भी उसका कैसा होगा, painful होगा. So how you should remember is, आज से आप लोग सिफिलिस का जो स्पेलिंग है वो ऐसे लिखना, syphilis. This condition is a painless. Okay. So this is a syphilis. What is the causative agent of the chancroid? It is a Haemophilus ducreyi. So from the cray makes you cry. Because it makes you cry, what you will remember? Painful ulcer, painful lymph node. Now you can answer non-suppurative lymphadenopathy is a feature of non-suppurative. If I am asking you non-suppurative herpes, you will answer the condition which is because of the virus. Bacteria will cause suppuration, not a virus. So you can easily answer this. So before you start your notes, on your notes write down, if there is a painful ulcer and painful lymph node, you will answer it as a chancroid. Positive agent is the Haemophilus ducreyi. Which you cry. Haemophilus ducreyi makes you cry. So this disease is causing ulcer painful and lymphadenopathy also painful. And as I told, remember syphilis like this. It is a painless condition. Ulcer is also painless. Lymph node is also painless. But if you see ulcer is painless but lymph node are painful, it is a lymphogranuloma venereum. What is the positive agent of lymphogranuloma venereum? Chlamydia L type. Chlamydia L type cause lymphogranuloma venereum. Chlamydia causes lymphogranuloma venereum. So syphilis is a easy condition, but you just have to create a mind map how this disease occurs, so you can answer these questions. Okay, so let's understand what is this clinical vignette is telling you. A 23-year-old male had an unprotected sexual intercourse, and after this he developed the lesion as showed in the image. It is not painful. Patient also developed enlargement of the lymph node, which is not painful. What is the most appropriate diagnostic test? An image is also given. So even if you know the ulcer of the syphilis, you don't have to read the question. You can directly read the last line. What is the most appropriate diagnostic test? Right? So what I'm seeing here is I can see that this patient is having an ulcer here. Right? What is the peculiarity of this ulcer? First of all, single concrete border, and if you see, it is slightly above the skin. It is raised. Why it is raised? Because there is an induration present. There is a slight fluffiness which makes this induration, and this because of this induration, it is having a tender condition. Tender means if you touch it, it will feel like a fluffy. Okay, so it is raised above the skin, but it is painless. Okay, painless. It is painless. Sorry. So, what is the diagnostic test at this point? So, what you will answer? So, first of all, if you have a basic microbiology concept, what is the positive agent of syphilis? Treponema pallidum. Is Treponema pallidum having a cell wall? No cell wall, because it is a spirochete bacteria. If cell wall is not present, can I stain that bacteria? I cannot stain this bacteria. So what I will not answer? I will not answer gram stain. I will not answer ginseng stain. I am not suspecting HIV also. So what is the dark field microscopy? What I will do? I will take some sample, because underlying these, there are many Treponema pallidum virus like this. So I will take a sample and I will put under the dark field microscope. This dark field microscope has a dye which will attach to the Treponema pallidum. And when I will make the area extremely dark, this dye will illuminate, and which tell me that the bacteria Treponema pallidum is present. So what I am telling you is, this is a primary syphilis. So what is the meaning of primary syphilis? Because of the unprotected sexual intercourse, this bacteria inoculated here, right? After this, there are blood vessels also, right? Underlying it, there are blood vessels. So if this bacteria enter our blood vessel and go all over the body, it will cause secondary syphilis. And after the secondary syphilis, now this bacteria will go latent. They will remain in our body, but it will not cause any disease. And after many years, if this patient is not treated, this patient will come to us with a finding of tertiary syphilis. So, in your mind, it should be clear, if the ulcer is present on the genital, primary syphilis. Is rash present all over the body? Secondary syphilis. No symptoms means latent syphilis. But if I see the blood test and I send the blood test for the antibody against Treponema pallidum, I will do the VDRL test. What I will find? I will find that this patient is having the antibody. So you all know when we have a blood donation camp, right? In India, we have a blood donation camp. And when we check some of the patient's blood with the VDRL, we come to know that some of these patients are the syphilis positive. Then it is not exposed in the in the newspaper or anything. So we collect the personal address and we will get in touch with him and we'll tell him that your sample came positive for the VDRL. So you should get checked and we will ban this person to have a blood donation further also. So we will mark this ID. So what I'm telling is the VDRL test will find out a latent syphilis. So see this, we will discuss this. First is a primary syphilis. What is the meaning of primary syphilis? Primary syphilis is known as a chancre, primary chancre. Primary syphilis is a localized it causes primary chancre in the 1 to 90 days. This is also known as a Hunterian chancre. This is hard. Mostly it is a single. The border is regular or concrete border. Patient will have a inguinal lymphadenopathy, which will be the painless. This lymphadenopathy is painless. This ulcer will heal in 1 to 4 months. It heals in 1 to 4 months. Most common extragenital site of chancre is a lip. Most common extragenital site is a lip. For the diagnosis, we will do dark ground illumination. We will do dark ground illumination. It is the most sensitive and the most specific. It is the most sensitive, most specific. Which blood test I can do? So this is the microbiology test, right? I can also opt for the enzyme immunoassay. But this enzyme immunoassay I can do only at the 3 weeks. During the first 3 weeks. And it is the most sensitive blood test. Okay. It is the most sensitive blood test. VDRL can be done at the 4th week because it will take some time to form proper antibody against it, right? So VDRL at 4 weeks. Okay, now VDRL? I don't know the full form. It is a venereal disease. I don't know. I don't remember, but it is a venereal disease whose reactive antibody or something. So VDRL, it is very old name. I have been using this VDRL. I never searched for the VDRL full form. But VDRL looks for the antibody complexes. So it is a diagnostic test which was developed. So secondary syphilis. Now see this. As I told, secondary syphilis means blood dissemination of the bacteria. It is a blood venereal disease research laboratory. Blood dissemination. It is a blood dissemination all over the body. After 6 to 8 weeks of the primary disease. So in 6 to 8 weeks, what will happen? This bacteria will travel all over the body and will cause systemic manifestation. So as you can see, the most common presentation is a rash. So in dermatology, always remember that mnemonic cars, right? If they are giving you a photo which is showing you a more lesion on the palm and sole, these are the three important diseases you should remember: Coxsackie A virus, hand, foot, and mouth disease, Rocky Mountain spotted fever, and the third is a syphilis. As in this image, you can see they are showing you a maculopapular lesion involving. So these three infections are very important that you should know. Most common presentation is the rash here, and as I told, condyloma lata. So can you differentiate condyloma lata and condyloma acuminata? What was the condyloma acuminata? That was the pointed lesion. But what are the condyloma lata? Lata means flat cauliflower-like lesion. These are the condyloma lata. So write down condyloma lata. These are the flat cauliflower like mass. They can ask you condyloma lata is a feature of primary or secondary syphilis. This is a finding of secondary syphilis. Rash is also secondary syphilis. Now, what will be the lymphadenopathy? Lymphadenopathy is a generalized. Patient will have a generalized lymphadenopathy. In the syphilis, suppose this is my dermis layer. In this dermis, I have a blood vessels. In this blood vessel, this bacteria will cause end arteritis, inflammation. It will cause inflammation. So on a soft touch, as I told you, these rash are not painful. What we told, in syphilis, everything is a painless. But because of the vessel inflammation which is caused by this bacteria, if I strongly press, what will happen? It will become painful. This condition is known as a deep dermal tenderness, or this sign is known as the Ollendorff sign. Deep dermal tenderness or the Ollendorff sign. Patient will have a alopecia, and in this alopecia, patient will have a patchy hair loss. Small area of the hair loss you will notice like an insect has bitten the scalp. So that is why this finding is known as a moth-eaten alopecia. Moth-eaten alopecia. Investigation of choice in the secondary syphilis is a VDRL. It is a VDRL. ओके, तो सेकेंडरी सिफिलिस में इतनी 5-6 साइन है जो याद रखनी है. ओके, लेटेंट सिफिलिस में याद कुछ नहीं रखना है. दैट सिम्टम्स आर एब्सेंट. सेकेंडरी सिफिलिस after 3 to 12 weeks, patient will not have any symptom. Patient will not have any symptom. Only serological evidence present. Okay. So now what this bacteria will do, this bacteria will go deeper into our tissue, and when they go deep into the tissue, it will cause tertiary syphilis. And tertiary syphilis, by forming the deep gumma, as you can see, there is a swelling of the skin. So our internal mucosa will have a large swelling like this, because this bacteria is going deeper and deeper into our tissue. So write down tertiary syphilis. ज्यादा है नहीं इसमें, खाली समझना है कि लेटेंट के बाद टर्शरी आएगा. लेटेंट का मतलब क्या होता है? नो सिम्टम, राइट. सेकेंडरी के बाद होगा 3 to 12 वीक में सारे सिम्टम्स खत्म हो जाएंगे, एंड बैक्टीरिया विल गो डीपर इनटू द टिश्यू. So for some years it will not cause the disease. So tertiary syphilis, now after 10 to 20 years, patient will develop a manifestation of the syphilis. So what will happen to the skin? On the skin, I will have a gumma formation. If cardiovascular system is affected, arteritis. This appearance is known as a appearance. Okay. This appearance is known as a tree bark appearance. When the central nervous system is affected due to syphilis, which column is commonly affected in syphilis? The MCQ asks. It affects the posterior column. The disease is known as the tabes dorsalis. In medicine also they commonly ask this question: what part of the spinal cord is affected in tabes dorsalis? It is a posterior column affected. So in the CNS syphilis, if I want to diagnose this, investigation of choice is a CSF VDRL. It is a CSF VDRL. Okay. Treatment. Drug of choice treatment. Benzathine, penicillin. Drug of choice is a benzathine, penicillin. If patient is allergic, which medicine can be used? We can use doxycycline, right? In pregnancy, what is the drug of choice? Same. It is a benzathine, penicillin. But if allergic, can I give doxycycline? Doxycycline is a teratogenic, and that is why these MCQs ask if pregnant female having syphilis and allergic to penicillin, you will do desensitization, and after the desensitization, you will give penicillin. So you have to give penicillin, but the first is a desensitization. छोटा छोटा डोज देते रहेंगे, फिर क्या होगा, थोड़ा सा भी माइनर एलर्जिक रिएक्शन आएगा, वी विल ट्रीट इट विद स्टेरॉइड एंड एंटीहिस्टामिन, then slowly we'll increase the dose, then slowly we'll increase the dose. Like this, we will want to make some resistance, and then we will give adequate dose after few days. So this is a desensitization. We cannot give the direct full dose of a million unit. Congenital syphilis. What are the three important findings of congenital syphilis? Congenital syphilis are of two types. Early features, as soon as the child is born. What are the early features you will notice in the first month of life? Early congenital syphilis, rhinitis. In some of the MCQ, they use this word snuffles. Okay, rhinitis is the most common sign and the most earliest sign. It is a syphilitic pemphigus, and this is the most feature of early congenital syphilis. Patient will have a hepatosplenomegaly. Patient will have a hepatosplenomegaly. Along with this, you will see Parrot's pseudoparalysis. So what is Parrot pseudoparalysis? That baby will have a too much pain on his or her limb that she will not move, and because of this, it will look like that baby is having a paralysis. This is known as a pseudoparalysis. Parrot pseudoparalysis due to epiphysitis or the osteochondritis. Epiphysitis or the osteochondritis. Which vitamin deficiency causes pseudoparalysis? Pseudoparalysis? Scurvy. Scurvy, vitamin C, no? Okay, scurvy causes a pseudoparalysis. And like scurvy, also here you will see Wimberger's. स्कर्वी में दिखती है ना विमबर्गर साइन, राइट? ड्यू टू metaphyseal destruction. Wimberger sign is due to metaphyseal destruction. Okay. Late congenital syphilis. Late means now child is growing, but if he is not treated, so he will develop a defects. विम्बर्गर साइन मेटाफिजिकल डिस्ट्रक्शन की साइन है. स्कर्वी में भी दिखते हैं ना विम्बर्गर साइन ड्यू टू मेटाफिजिकल डिस्ट्रक्शन. Sure. See, late congenital syphilis. What are the late changes? That the child will have a Hutchinson's teeth. Child will develop a interstitial keratitis and the sensory neural hearing loss. Sensory neural hearing loss. These are the findings of the late congenital syphilis. These are the findings of the late congenital syphilis. Apart from this teeth defect, child can also have a mulberry molars. Mulberry molars. Child can have Clutton joints. What is this Clutton joint? It is a painless swelling of the knee. Painless swelling of the knee.
सुनो इसको निकालो जरा येलो को. ये भी मैं सूट पहन रही हूँ बस हो गया. ये भी प्यारा लग रहा है यार.
Saber tibia. Saber tibia. Olympian brow. And the saddle shaped nose. Clutton joint. Clutton joints. चलो सबकी इमेजेस देख लेते हैं. अरे वही दिखा था ना तब, वही तो इमेज दिखा रहा. पहले तो देख लो हचिंसन टीथ. इमेज पता ही होगा, देखी होगी आपने हचिंसन टीथ. दिस नोज, saddle shaped nose. Okay, there is a depression of the nasal cartilage. Saddle shaped nose. Mulberry molars. क्या ये? There are too many cusps present. Generally, there are 4 cusps, but you can see multiple cusps present. These are the mulberry molars. This is the Olympian brow because of the swelling of the frontal bone. Because of the swelling. This is the Olympian brow. Or frontal bossing. Okay. What is saber tibia? Saber means, in a Latin, saber means sword. Sword कैसे anterior board होती है ना? So similarly, anterior bowing of the tibia. Anterior bowing of the tibia, which is known as the saber tibia. This is known as the saber tibia. Okay. So how to diagnose congenital syphilis? Yeah. So how will we will diagnose congenital syphilis? What was the most common in the earliest sign? It is the rhinitis. Most common and the earliest sign was the rhinitis. So what I will do, I will take a nasal secretion and see under the dark field microscope. Diagnosis of congenital syphilis. Nasal secretion. Nasal secretion. Dark brown illumination. So DGI for the nasal secretion. Second, I can look for the VDRL. I will look for the VDRL. And this VDRL should be 4 times mother's level. So in the children, this VDRL should be 4 times mother's level. And this is the investigation of choice. So if they ask investigation of choice, answer will be the VDRL. But you will diagnose only when the level is more than 4 times. When the level is more than 4 times. If I want to see what is the treatment response, so patient is suffering from the syphilis, I have given the bandage and penicillin. Now, which test will tell me that my treatment was adequate or no? Answer is the VDRL. So what you will look for? Whatever the VDRL level was after the treatment, after 1 week, it should be reduced. So for the treatment monitor, for treatment monitoring, answer you will give is a VDRL. And most of the students get confused. What we got the treatment of choice in a syphilis, tertiary syphilis. If I say CNS, which is a Aedes dorsalis, in that condition, you will answer CSF VDRL. But if they are not asking about the central nervous system, then FTA-ABS. So this is the diagnostic stage. We look for the antibody. FTA-ABS is an antibody test for the tertiary syphilis, or either I can look for the Treponema pallidum particle agglutination. So they will not write this full name. They will generally write TPPA. Okay. In your exam, they will write TPPA. This is the Treponema pallidum particle agglutination. Second is the Treponema pallidum heme agglutination. So this is the heme agglutination. So this test you can opt in the tertiary syphilis if they are telling you in the blood. Okay. So remember, in exam, I have never seen writing them full form. They are always writing TPPA and TPHA. So from the T and P, you should remember it is a Treponema pallidum. If you remember like this, you can be able to answer, because there is no other diagnostic test in other diseases which is like this, which is named like this. So TPPA and TPHA. हीम अग्लूटिनेशन नहीं सेम ही है ना, टीपीपीए एंड टीपीएचए एक साथ ही करते हैं हम। ट्रिपोनेमा पालिटम जैसे ही हमें मिल गया, उसके दो प्रकार के एग्लूटिनेशन कर सकते हैं, आइदर पार्टिकल एग्लूटिनेशन करें, आइदर हेम एग्लूटिनेशन करें। दोनों की सेंसिटिविटी स्पेसिफिसिटी सेम है। ओके, ड्रग ऑफ चॉइस में याद रखेंगे बेंजाडाइन, पेनिसिलिन एंड द डॉक्सी। ओके, सी दिस multiple painful ulcer. So it is a multiple and painful. So if it is a painful, you will not answer LGV. LGV cause painless ulcer. Centroid, syphilis also painless, so you will not answer this. Granuloma inguinale painless. What is answer? Centroid. Answer is centroid. And if I see the bacteria of the centroid, which is a Haemophilus ducreyi, so this MCQ was asked, school of fish appearance is seen in. So what is a school of fish? This bacteria is going together in a group. So it is known as a school of fish or a railroad track appearance. Okay, school of fish or railroad track appearance. See this. We will write down few important points on a centroid. So by the looking at the image, now you can identify which is centroid. What you will look for? You will look for the multiple painful ulcer. Positive agent is a Haemophilus. Positive agent Haemophilus ducreyi. Incubation period is 3 to 10 days. Patient will have a painful multiple painful genital ulcer. These ulcers are soft, tender, without regular border. So this border will constantly be changing without regular border. Along with painful lymphadenopathy. And in the inguinal area, there is an extensive enlargement of this lymph node, which is known as a bubo formation. Which is known as a bubo formation. As you can see, this ulcer is extensively large, but when this surface touching the opposite surface, it will cause a new ulcer on the opposite side, right? Because when this vulva, female vulva will close, this bacteria will inoculate on the opposite side and the both side will have ulcer. Okay, this auto inoculation lead to multiple ulcer, and this is known as a kissing ulcer. Because of the constant touching, the ulcer number increases. If I do the gram stain, it is a school of fish or a railroad track appearance. It is giving me a railroad track appearance. Diagnostic test, ETO test. Diagnostic test is a ETO test. Nowadays, it is not commonly used. drug of choice is the azithromycin. In chancroid, drug of choice is azithromycin. Sexually transmitted disease में most commonly azithromycin and doxycycline, ये दो medicine यूज होती है. So here in chancroid, drug of choice is a azithromycin. सिफिलिस में syphilis में drug of choice benzathine penicillin है. But as you can see, benzathine penicillin is not commonly used. That is the secondary drug is the second drug of choice is doxycycline. हमने लिखा ना second drug of choice कौन सी है? Doxycycline. So azithromycin and doxycycline can treat most of the disease sexually transmitted. Right? It can treat, no? Doxy can treat. Sorry. ETO test. ETO test is absolute nowadays. It is not commonly done. ETO test was done to identify the reaction against this bacteria, but it was too difficult. So that is why gram scale is more important nowadays. So this is just in the literature. So that is why I do not press too much importance on it, because ETO test and Fry test. Fry test was done for the lymphogranuloma venereal. They both are the old test. Nowadays, no labs are doing this ETO test. Okay. कौन सा ना? ये वाला? Oh, sure. See this safety pin appearance. Safety pin appearance is seen in Calimactobacterium granulomatosis. So what is safety pin appearance? ये तो माइक्रोबायो में ये क्वेश्चन पूछता है ना. So why we have a safety pin appearance? Because of the bipolar staining. So there are 4-5 bacteria which shows bipolar staining. So आप जब घर जाओगे तब देखना. But in sexually transmitted disease, this bacteria causes the ulcer. You see this. If you see this ulcer, you will not get confused. It is a donovanosis. This ulcer is a donovanosis. Okay. What is the causative agent of the donovanosis? It is a Klebsiella. It is a Klebsiella granulomatosis. Donovanosis is caused by the Klebsiella granulomatosis. Or the second name of this bacteria is a Calimactobacterium. It is a Calimactobacterium. The ulcer is a painless ulcer. This ulcer is a foul smelling. Along with this foul smelling, beefy red, it will have a beefy red, granulation tissue. It has a beefy red granulation tissue. On the ulcer floor. In the inguinal area, you can see granulomatous swelling. In the inguinal area, you will see granulomatous swelling, but no lymphadenopathy. no lymphadenopathy. And because of this, the question was asked, pseudobubo formation is seen in. So remember this MCQ point. In which disease you will see the pseudobubo formation? It is the donovanosis. Drug of choice is the azithromycin. Drug of choice is the azithromycin. You will give this 1 gram once per week. 1 gram once per week. Or second medicine is a doxycycline can be given. Second medicine, doxycycline. You will give 100 milligram twice. 100 milligram twice. Okay. See this groove sign. So in all the disease, I showed you the photo of ulcer. But in the lymphogranuloma venereum, I am showing you the photo of the lymph node. Okay? Why? Because you will not see the ulcer in a case of lymphogranuloma venereum. Because patient will not come to you. Because this will be the minor erosion on the genitals. So patient will think that this is just a normal erosion. So he will not come to the doctor. But he will come to the doctor when he will develop a lymphadenopathy in the inguinal area. And this lymphadenopathy will be the, as you can see, inflammation, right? So this will be the painful condition for the patient. So because of this condition, patient will come to you. So two important clinical features you should know, that patient will not come at the stage of ulcer. He will come. No, there is no pain of ulcer. That is what I am telling you. अल्सर जो होता है वो तो ट्रांजिएंट होता है. इट इज जस्ट फॉर द मैटर ऑफ 1 डे. एंड बिकॉज ऑफ दिस क्या होगा, पेशेंट कब आएगा, व्हेन समथिंग इज बॉदरिंग हिम, राइट. व्हाट इज हैपनिंग इन लिम्फोग्रैन्युलोमा वेनेरुम, अल्सर आर सुपरफिशियल एंड ट्रांजिएंट, so he will not go to the doctor. But after a week, what will happen when he develop a lymphadenopathy which is painful? Now he will go to the doctor. So that is why in lymphogranuloma venereum, the lymph node is affected, and because when the lymph node is affected, you all know what will happen to the lymph flow. It will get blocked. So what will happen? You all know the disease elephantiasis. In filaria parasite is obstructing the lymph flow. What is happening? Leg gets bigger. So because of this MCQ was asked, genital elephantiasis is seen in a which sexually transmitted disease? It is in a disease in which lymph nodes are severely affected. This is a lymphogranuloma venereum. Okay. So we will write down the few important points on a lymphogranuloma venereum. What is the causative agent? Causative agent is a chlamydia. Causative agent is a chlamydia. Incubation period is 10 to 30 days. Incubation period is 10 to 30 days. Primary stage. So I will not write ulcer. This is a painless. It is not generally a ulcer. Ulcer are deep, but these are the just mucosal defect, which is a erosion. Whereas secondary stage is the bubo formation. Secondary stage is of the bubo formation. and this will be the painful. And the two groups of lymph node involved, and because of this, because of the two groups of the lymph node are involved and the ligament is passing by between them, this sign is known as a groove sign. This sign is known as a groove sign. And because of the lymphadenopathy, patient can develop genital elephantiasis. Genital elephantiasis. What is the investigation of choice? It is a nucleic acid amplification. It is a nucleic acid amplification test. Frey test in microbiology is still in your textbook. It has been given Frey test, now not done. Frey test was used for this, but nowadays not done. Drug of choice, as I told, it is a doxycycline. Drug of choice is doxycycline. ग्रुप साइन में क्या होता है? As you can see in this image, this is the one group of lymph node, which is a inguinal group of lymph node. ये बड़ी हुई है और नीचे की femoral group of lymph node भी बड़ी हुई है. And उसके बीच में थोड़ा सा depression. Because of this depression, this sign is known as the groove sign. Okay, because two groups of lymph node are being separated by the ligament. That is why groove sign. That is why groove sign. So in government there are three important kits. So see this. Nowadays they are asking MCQ on these kits. The kit one is a gray color. So in gray color kit, if you can see here, what is the medicine? Azithromycin and the cefixime, right? Azithromycin and cefixime. So kit one is given when the male patient is coming to me that doctor, I am having a pus discharge from my penis. After the urination, the pus is coming out. In this situation, which kind of urethritis you will think? Urethritis caused mainly are two: Neisseria gonorrhea, and the chlamydia, right? Neisseria gonorrhea and the chlamydia cause urethritis. So in India, we are not going to confirm every finding in the patient. So what the NACO has done, NACO has made some kit which will cover both the bacteria. So as you can see, gray kit contains, so you write down gray kit as a two medicine, azithro plus cefixime. Azithro plus cefixime. They both combinedly cover Neisseria gonorrhea and chlamydia in case of pus discharge from the urethra. So in recent NEET exam, okay, so photo was given with a penile, pus discharge, and what is the treatment of choice? You will combinedly treat with the azithromycin and cefixime. आज हमने बुल्बो वजाइनाइटिस पढ़ा था, So what was the three causes of the vulvovaginitis? Gardnerella vaginalis, trichomonas, and the candida. अब हमारे इंडिया में from the tribal area when the woman comes, so she will not be able to tell you in detail what kind of discharge, right? What is the smell and everything. So when she is complaining to you, the NACO has provided us a kit. In kit 2, which is a green color, what are the medicine? The medicine it contains the sacnidazole. So sacnidazole is a metronidazole, right? Sacnidazole is a metronidazole. It will cover which two conditions? Gardnerella vaginalis and the trichomonas. It will cover Gardnerella vaginalis. It will cover trichomonas also. Along with it contains the fluconazole for the candida. Okay, so two drugs, sacnidazole and the fluconazole. So green color kit is for the vulvovaginitis. So हमारे PSC सेंटर में हम सारे डॉक्टर्स को ये दो किट दे के रखते हैं. If male is coming with the discharge, you will give gray color kit. If female is coming, green kit. Okay. And now if the male patient is coming to me that doctor, I am having a swelling in my inguinal area. So what is that? It is a bubo formation. What are the two diseases we discussed which cause the bubo formation? LGV and no, Donovanos is a pseudobubo, no? Donovanos is a pseudobubo. Second answer is a centroid. So if any person is coming to me with a inguinal swelling, I will give a black kit. As you can see in this black kit, what is written? It is a inguinal bubo syndrome. The two drugs we give is a doxycycline and azithromycin. Doxycycline and azithromycin. This doxy for 100 milligram into 21 days. This is for the if we are suspecting lymphogranuloma venereum. Azithromycin 1 gram is for the chancroid. Is the black kit number 7 or 6? यार मैंने तो नाको की वेबसाइट से लिया है, 7 ही होगा. इसमें हाँ. So I have to check. I just take the photo from the NACO website, so I don't know. I will check and will let you know. Okay. Sorry. कितना नंबर जानना जरूरी है? कलर जानना जरूरी है. कलर जानना जरूरी है. Even if you don't know the color, what you should know is if there is a urethral discharge in your question, in clinical question, if you are giving the complaint of a male urethral discharge, answer is a azithromycin plus cefixime. If vaginal discharge, metronidazole or sacnidazole plus fluconazole. If lymph node swelling is there, black kit, azithromycin and doxycycline. You should know the combination of drugs. Okay, they are not going to ask you the color and everything. Okay. So blistering disorder. ब्लिस्टरिंग डिसऑर्डर पढ़ते हैं। ये हमने ऑलमोस्ट पैम्फिगस बहुत डिटेल में हम हर एक स्टेज पे देखते आए हैं, so it will be just an overview. So now tell me, what is a subcorneal blister? What is the meaning of subcorneal? Below the which layer? Stratum corneum. It is below the stratum corneum. It is seen in pemphigus. It is seen in the pemphigus foliaceus, staphylococcal scalded skin syndrome. Spinous layer is most commonly affected in eczema. We discussed in the first class, spongiosis will involve which layer mainly? Spongiosis, intercellular edema, right? What is the meaning of spongiosis? Intercellular fluid accumulation. It was the feature of eczema or the atopic dermatitis. Which layer is most commonly affected? Stratum spinosum. So if I ask spinous layer blister, answer will be the eczema. Eczema. Suprabasal blister. Suprabasal means above the basal cell layer. So these are the vertical cell, and above this basal layer, I have a lesion in the pemphigus vulgaris. In the Derrier's disease, and the Hele disease. Okay, we will discuss the first disorder. Pemphigus. The first disorder is a pemphigus. Pemphigus are mainly of the two types. The one is a pemphigus vulgaris. This is the most common type because it is ending with the vulgaris, right? Vulgaris is always the most common type. So which pemphigus is most common? Pemphigus vulgaris is most common. The first site of the involvement. First site of the involvement is mouth. So remember, this is an important feature. The reason is in pemphigus foliaceus, mucosa is not involved. Mouth area is not involved. Will you see the Nikolsky sign in this disease? Right. So because antibody in this disease, antibody is against the desmosome. So what are these desmosomes? See this. I will form antibody against desmoglein 1, which will give me the cutaneous pemphigus vulgaris. Okay. And the second antibody is against desmoglein 3. Second antibody is against desmoglein 3. It will cause mucus plus cutaneous pemphigus vulgaris. So you remember like this, 3 is equal to m. Okay, 3 को ऐसे उल्टा कर देंगे तो m पता लगेगा. So 3 is equal to m. So when there is a desmoglein antibody 3, you will see the mucosal involvement, and that is why in pemphigus vulgaris mucosal involvement is the first. This will lead to Nikolsky sign positive. Nikolsky sign positive because acantholysis. When we discuss Nikolsky sign, what was the true Nikolsky sign? When the acantholysis is present, it is known as a true Nikolsky sign. So here you will see both sign positive. Okay, so see this first of all. See this. What I told in pemphigus vulgaris, two type of pemphigus vulgaris, purely cutaneous, and the second is the mucocutaneous. As I told, in the mucus variant, what will be the antibody? Anti-desmoglein 3 antibody. In the second variant, I can have both antibody, right? So anti-desmoglein 1. See this pemphigus foliaceus. So as I told you, what was the desmosome? Desmosome was connecting to keratinocyte. So let's take an example of this building. These are the 3-floored building. In this 3-floored building, this is the pillar which is working as a desmosome. This pillar is connecting 1, 2, and 3rd floor, all these 3 floors. But suppose the rod of the 3rd floor, I bought it from some other city. Rod from the 1st floor, I bought it from some other city. But it happened that on the 3rd floor, these rods are of the bad quality. So what will happen? This will get ruptured, and because of this, my 1st and 2nd floor are intact, but 3rd floor is lost. So what will happen? The fluid will accumulate here, right? Similarly, in pemphigus foliaceus, the desmosome destruction you see is in the upper part, and because of this, a fluid will start accumulating here, and this person will have a blister. So as you can see, what thickness I have available above the fluid? Very less fluid. So what will happen? As soon as I have a fluid-filled blister, because of some friction, it will get ruptured. So in pemphigus foliaceus, what you will see is suddenly I have a fluid-filled blister and it is very fast rupturing. The reason is very less skin available above the fluid. That is the one point you should remember in pemphigus foliaceus. In pemphigus foliaceus, you see only desmoglein 1, no desmoglein 3 involvement. So mucosa is not involved. These are the second differentiating point. So subcorneal blister and the no mucosal involvement. Okay. Coming to here, in pemphigus vulgaris. In pemphigus vulgaris, what happened? The destruction of desmosome occur in the lower floor, and because of this, as you can see, the fluid accumulation is here. So what we wrote? What is the level of blister? Suprabasal. The blister is a suprabasal. And what is the thickness available? I have a more thickness available. So this bulla will not rupture easily. And if you make a pressure, which is a bulla spread sign, you can if you put a mild pressure, this fluid will shift inside the other area also. So bulla spread sign is present on the pemphigus vulgaris. In the lower portion, you will find this. The second finding is row of the tombstone appearance. Because in the pemphigus vulgaris, fluid is just above the basal layer. So as you can see, on the basement membrane, I have an intact vertical cell present. So this appearance is known as a row of tombstone appearance. Row of the tombstone appearance. Pemphigus vulgaris is a very important MCQ being asked from this topic. Okay, so see this. We will write this. In pemphigus vulgaris, acantholysis is present, and the lower portion of the stratum spinosum is damaged, and because of this, the accumulation of the fluid which I will see is the supra basal blister. This blister will be the suprabasal. And this appearance is known as a row of tombstone appearance. Bulla spread sign. Bulla spread sign is positive. On a direct immunofluorescence, which pattern you will see? Because antibody is killing this desmosome, you will see fishnet pattern. You will see fishnet pattern. Treatment is a steroids. Treatment is a steroids. It is not required. Plasmapheresis is very high class treatment. It is not required. By steroid you can treat it. Yes, but any autoimmune condition, if you want to remove these antibodies, plasmapheresis can be helpful. Second is a pemphigus foliaceus. So we will write only important feature. In this disease, antibody against desmoglein 1, no mucosa involved. Upper part of the stratum spinosum affected. The blister is a subcorneal blister. Blister is a subcorneal blister. So fishnet pattern you will see will be the same. Okay, all the diagnostic signs are the same, but rest are the same. Okay, all the signs and everything are the same. Only remember, because these are the superficial, the bulla spread sign is negative. Bulla spread sign is negative because it is very superficial, it will get ruptured. Bulla spread sign is negative. निकोल्स की साइन तो वो तो हो रहा है ना, डेस्मोसोम तो डैमेज हो रहा है, तो निकोल्स की तो पॉजिटिव रहेगी. सो सारी साइन पॉजिटिव सेम ही रहेगी. अकांथोलाइसिस होगा, निकोल्स की पॉजिटिव रहेगी, राइट. एपिडर्मिस एंड डर्मिस तो अलग ही हो रहा है. अलॉन्ग विथ फिश नेट एंड नेट पैटर्न भी सेम रहेगी. ओके, फिश नेट पैटर्न की फोटो दिखाई थी मैंने पहले. Which immunoglobulin is it? IgG damaging desmosome. Okay. Now second disease. So just add in your notes which drug causes drug-induced pemphigus. Drug-induced pemphigus. The most common is a penicillamine. The most common drug which causes drug-induced pemphigus is a penicillamine. In which disease we use penicillamine? विल्सन में पहले यूज करते थे, बट अगर अभी पूछे तो पेनिसिलामाइन जवाब मत देना. कभी पेनिसिलामाइन का एक कॉपर किलेटिंग एजेंट है, कॉपर सल्फेट पॉइजनिंग में भी यूज करते हैं. इन विल्सन डिजीज अब हम क्या यूज करते हैं? जिंक यूज करते हैं. जिंक एंड ट्रायंटीन, दो आंसर करना. पेनिसिलामाइन वाज द ओल्डर ट्रीटमेंट. ओके, पेनिसिलामाइन कॉज ड्रग इंड्यूस्ड पेम्फिगस. नाउ बुलस पेम्फिगॉइड. In a bullous pemphigoid, if you can see here, what is the location of blister in bullous pemphigoid? No, he was right. Above the epidermis, because the whole epidermis is lifted up. Because in bullous pemphigoid, which protein is damaged? Hemidesmosome. So what will happen? Whole epidermis will get lifted. So I can say this blister is a sub-epidermis. So what you have to remember is a antibody against the hemidesmosome. What will be the deposition of antibody? It will be the linear deposition. Deposition will be the linear. So these are the 3-4 important points you should know about the bullous pemphigoid. As you can see in this image, because now I have a thickness of whole epidermis, the fluid will stay inside the skin. The bulla will not rupture. If you can see in this image, if I have a thickness of whole epidermis, fluid can easily stay. Because I have a tight connection of the desmosome. So this bulla will not rupture easily. And as you can see, where was my melanocyte? My melanocyte was here. If my basement membrane is having some damage, what will happen? I will not have a melanocyte. So when this lesion will heal, it will heal with the hypopigmentation. Why? Because this melanocyte will get lost. Okay. So these are the few important points which are important in bullous pemphigoid. In bullous pemphigoid, the location of the blister is a subepidermal. Subepidermal blister. The reason is anti-hemidesmosome antibody. It produces anti-hemidesmosome antibody. which is anti-BP1 and anti-BP2. Anti-BP1 and BP2. Mucosa is involved. Mucosa is involved in 1/3 of the patient. So now tell me, will you see acantholysis? Acantholysis not present. So no acantholysis. No acantholysis. What about the Nikolsky sign? Absent. Because Nikolsky is generally epidermal layers are being separated. But here what is happening? Epidermis whole itself is a thick. Just fluid is being accumulated. So absent Nikolsky. So Nikolsky you will only answer if there is an active acantholysis or a destruction of keratinocyte above the basal membrane. Okay. Nikolsky sign. What about the Bulla spread sign? Bulla spread sign will be the positive. Bulla spread sign positive. This lesion heals with when this lesion heals, they heal with the hypopigmentation. Lesion heals with the hypopigmentation. On a direct immunofluorescence, I will have a linear deposition. Linear deposition of immunoglobulin G. Linear deposition of immunoglobulin G. So we discussed about the 3 linear deposition. What was the that deposition? 3 depositions. So suppose this is my basement membrane, and on this basement membrane I have a deposition like this. And if in your exam this deposition is a immunoglobulin G, what is the answer? Bullous pemphigoid. If I say this deposition is of IgA, if I say linear deposition of IgA, it is a IgA dermatosis. Okay, linear deposition of IgA dermatosis. Second answer, linear deposition along with a increased deposition of IgA at the tip of the dermal papillae. So linear IgA with increased deposition at the tip of dermal papillae. अगर ऐसा लिखा हुआ है क्वेश्चन में, इट इज अ डर्माटाइटिस herpetiformis. Which disease is associated with dermatitis herpetiformis? Answer is a सीलियाक डिजीज एसोसिएटेड, कौन सी एंटीबॉडी देखेंगे? IgA एंटी टिश्यू ट्रांसग्लूटामिनेज, और सेकंड है एंटी एंडोमाइजियल एंटीबॉडी, एंटी एंडोमाइजियल एंटीबॉडी. So these words are important. If they are using the linear deposition of IgA with involvement of the dermal papilla, answer is a dermatitis herpetiformis. In one of the exams, they ask what is the drug of choice. Drug of choice in dermatitis herpetiformis is a Dapsone. Anti-tissue transglutaminase. Anti-tissue transglutaminase. सीलियाक डिजीज की एंटीबॉडीज याद कर लेना. ओके, एंटी टिश्यू ट्रांसग्लूटामिनेज और एंटी एंडोम्यूजियल एंटीबॉडी. So I will show you the photo. Direct immunofluorescence 4 याद रखना है, फिशनेट पैटर्न एंड 3 लीनियर पैटर्न. ओके, फिशनेट पैटर्न तो क्लियर है, पेम्फिगस वल्गारिस और फोलियसियस. लीनियर में 3 डिजीज याद रखना है, IgA dermatosis, bullous pemphigoid and dermatitis herpetiformis. So this is the 1, 2 and 3. Next topic is a dermatitis. बाकी है? एक काम करते हैं, टुमारो 3-4 घंटे का जो भी बाकी रहता है कल खत्म कर देते हैं, है ना? सो आपका सब्जेक्ट खत्म हो. सो कैन वी स्टार्ट बाय 12? आपका फिर 5 बजे कोई क्लास है? अर्ली? No, the thing is, then you have to come again. No, what I want is, जैसे क्लास खत्म होता है आपका दूसरा क्लास चालू हो जाए, तो आप सुबह पढ़ के आओ और फिर कंटिन्यू करो. फिर देखो, पढ़ाई में बीच में ब्रेक लेना, फिर वापस जाओगे, वापस यहाँ आओगे. तो इसलिए मैंने सजेस्ट किया है कि मेरा खत्म हो और फिर आप कंटिन्यू क्लास कर लो, है ना? सो व्हाट आई वांट इज, हम 12 बजे चालू करेंगे, but in the morning if you are waking up around 8:30 or so, after any breakfast, what I want is you go through these notes. We will quickly have a revision in 15 minutes of the important points. What I want is you don't have to look into this subject for a long time. So if you want to memorize everything, just revise this. We will have a quick revision. Okay, so what I want is I don't will be able to give you a lunch break. So it would be better if you are coming after 18. The thing is, if I giving you a 1 hour break, I will not be able, then it will be a rush for me. So what? Sorry? 12:30. वो तो मैं बाद में कभी दिखा दूंगा. But what I want is whatever I am teaching, it should be a multiple quality. 12:30. So let's see up to what time we are stretching up tonight. कितना बाकी रहता है जितना. Okay, so by 12 or 12:30 we will start. Sure. Okay. सही बात है, मेमोराइजिंग है ना, सारा याद ही रखना है सब कुछ, है ना। चलो ऐसे तो 11 बजे चालू करते, लंच ले लेंगे बाद में, ठीक है। ठीक, आज खाली डर्मेटाइटिस पढ़ लो यार, फिर अरे कुछ नहीं है, चार फोटो देखनी है बस, फोटो देख लो, फिर तो पीपीटी मिल जाएगी, मजे करोगे। खाली याद कैसे रखना है ये देख लो, ड्रग क्या है ना। अब ज्यादा वैसे अभी अगर हम कल खत्म कर देंगे, एक खाली डर्मेटाइटिस खत्म कर लेते हैं, ठीक है। 7:45 को क्लास एंड, ठीक है। 7:45 भी नहीं लगेगी, आधा घंटा लगेगा। चलो, एटोपिक डर्मेटाइटिस। So patient will have an allergy plus dermatitis means skin inflammation. So itching is the main criteria. Itching is the main criteria in atopic dermatitis. Important MCQ, it is a type 1 hypersensitivity reaction. It contains high amount of IgE, high amount of immunoglobulin E is present. तीन फेज होते हैं इसमें, इन्फेंटाइल फेज, we have a scalp and the face involvement. With the extensors. Second phase is the childhood phase. In this, flexor and extensor both are involved. Important point in adult, most common involves are the flexors. Most commonly involved are the flexors. एटोपी मोस्ट कॉमनली फैमिली हिस्ट्री तो प्रेजेंटली होती है। एटोपी मतलब एलर्जी कहते हैं, वेरी स्पॉन्टेनियसली कम ऐसा होता है कि वही है ना एटोपिक एक्जेमा, एक्जेमा वही है एटोपिक डर्मेटाइटिस। एटोपी का मतलब भी तो एलर्जी, एलर्जिक डर्मेटाइटिस वही है, बट एलर्जिक डर्मेटाइटिस कौन से अलग, एलर्जिक कॉन्टेक्ट डर्मेटाइटिस। अभी हम पढ़ेंगे एलर्जिक कॉन्टेक्ट डर्मेटाइटिस। अब वो क्या है, जैसे मैं कोई मेटल की कोई चीज पहन रहा हूँ जो बाहर से बनी हुई है, अगर वो मेटल मेरे लिए एलर्जिक है, सबके लिए एलर्जिक नहीं है बट वो मेटल मेरे लिए एलर्जिक है, तो वो है एलर्जिक कॉन्टेक्ट डर्मेटाइटिस, क्योंकि कॉन्स्टेंटली मेरे कॉन्टेक्ट में है ना, इसलिए डर्मेटाइटिस हुआ, तो वो एलर्जिक कॉन्टेक्ट डर्मेटाइटिस। एटोपिक क्या है, एनवायरमेंट के कुछ उससे मुझे बैरियर इंपेयर्ड है, तो कोई भी सब्सटेंस जो होता है वो जल्दी मुझे इन्फेक्ट कर लेता है और वो मुझे इच होती है वहां पे, तो ये वो atopic dermatitis. What are the signs of atopic dermatitis? Write down. The first is a Hertog sign. Hertog sign. Loss of lateral part of the eyebrows. loss of the lateral part of the eyebrows. Okay. It is a Hertog sign. As you can see in this patient, there is a loss of the lateral eyebrows. Second, this image is known as a Danny. This is a Danny Morgan fold. This is a Danny Morgan fold. Edema below the eyelid. It is a edematous fold below the eye. It is a Danny Morgan fold. It is a Danny Morgan fold. Headlight sign. Why the headlight sign? A person who has a atopy, because of the allergy, his cheek will be very red. But because the blood is deviated to the cheek, the person will have a circumoral pallor. So mouth will be pale, but cheeks will be extremely erythematous. So it is a headlight sign. It is due to circumoral pallor. It is a circumoral pallor. अब हम जहां पे itch ज्यादा करते हैं, wherever we itch more, what happens? The skin in that area thickens. So generally on our arm, every hair follicle is having a straight hair like this. But when you itch more, you will develop a papules, and because of these papules, the hair which is coming out will be the coiled hair, like this. Hair will not be a straight coming out. On the area where you have a more itch, the skin will thicken and hair will not come out as a straight hair. This sign is known as an antenna sign. अब दिया हुआ है, तुम लोग पूछते हैं तो ये होता है नहीं। वो फोटो इंडिया में लेते नहीं, अब सर्क्यूमोरल पहले इंडियन बच्चे में कैसे दिखेगा? हम इतने वाइट थोड़ी है कि इतना एरिथेमा दिखेगा। सही बात है ना, पिगमेंटेशन लेके बैठे हैं इतना। ये देखो, ये ऐसे जब पेप्यूल्स बन जाते हैं स्किन पे, तो हेयर जब आते हैं तो वो कॉइल्ड हेयर होते हैं। ओके, see this. So two important points: irritant contact dermatitis. So what is a irritant contact dermatitis? Two important things you should know, that it is an irritant which is causing the dermatitis. Okay, so when you use some utensil liquid, which is a very strong liquid, what will happen? You are washing the utensil, suppose for last 15-20 minutes, and because of this the barrier function is impaired, and now when your hand is coming in contact with the strong detergent and alkali, now that alkali will enter in your arm and will cause dermatitis. Okay, and that is why this dermatitis is known as a housewife's eczema. Okay, so when you have a wet work, because of the wet work, it will allow more irritant. So what are these irritant? Soap or the detergent. Soap or the detergent, right? Trigger factors. Yes, these are the trigger factors. The trigger factor here is a wet work. Generally, irritant cannot enter, as I told you. But when you are working for a prolonged period of time, in a water, what will happen? Your barrier is impaired, and now this the soap and detergent, which was not causing any problem to you, can cause dermatitis. Now it will cause dermatitis. That is why this is a housewife eczema. It is a housewife eczema. So remember, do not answer any kind of hypersensitivity in this. It is not immunological. So do not answer any kind of hypersensitivity reaction. This is not an immune dermatitis. So allergic dermatitis is a atopic dermatitis. But if I say allergic contact dermatitis, what is allergic contact dermatitis? Something in contact for a period of time. Either it can be any kind of slipper, chappal, sometimes clothes, anything can cause contact dermatitis. So commonly they ask what is a type of hypersensitivity. It is a type 4 hypersensitivity reaction. Which is the most common metal cause contact dermatitis? It is a nickel. Most common in Indian female can be because of the vegetables. So in female, some of the ornaments are made up of nickel as a content inside it, which causes the contact dermatitis. And because our mothers use our habit of vegetable cutting, sometimes in chilies and everything, they cause dermatitis. Okay, allergic contact dermatitis. How to diagnose? We will diagnose with a patch test. Patch test. We require 3 reading of this test. Second day, 4th, and the 7th day. Okay. On these days, I will check what is the allergic reaction. So पैच टेस्ट का फोटो तो देखा होगा कि बहुत सारे एलर्जिक बैग पे लगा देते हैं, 7 दिन के लिए रखेंगे और फिर देखेंगे कौन से जगह पे एलर्जिक रिएक्शन हुआ. हाँ, फोटो है बट ढूंढनी पड़ेगी, मैं कल दिखा दूंगा. मेरे एल्बम में होगी बट देखना पड़ेगा, अभी ढूंढना पड़ेगा इसको. ओके, सेबोरिक डर्माटाइटिस. सेबोरिक डर्माटाइटिस सबने देखा है, डैंड्रफ, राइट? सेबोरिक डर्माटाइटिस in common word, so क्यों होता है डैंड्रफ? The malassezia is increase in the area of sebum secretion. This malassezia fungus eats sebum. So in the area where there is an increased sebum secretion, this fungus will increase. And because of this, you will see yellow greasy scale in the seborrheic area. Collectively, because of this fungus and the secretion from our gland, you will see malassezia. No, globosa नहीं है, malassezia furfur, malassezia furfur, globosa, conglomata, बहुत सारे. और खाली malassezia स्पीशीज ही नहीं है, बहुत सारी फंगस है जो सीबम पे रहती है, हमारे बॉडी के नॉर्मल हैबिटेट है वो, बट वो इंक्रीज हो जाएगी क्योंकि वो वहां पे उनको खाना ज्यादा मिलता है ना. So what you have to do in the treatment of seborrheic dermatitis, you have to decrease the growth of this fungus and you have to decrease the sebum secretion, right? You will see yellow greasy scale in the seborrheic area. yellow greasy scale in the seborrheic area. See, in children in a newborn, if you see the scalp with a greasy scale, this is known as a cradle cap appearance. So cradle cap appearance is due to seborrheic dermatitis. It is due to seborrheic dermatitis. Cradle cap appearance, seborrheic dermatitis. For the treatment of seborrheic dermatitis, we start with the ketoconazole shampoo. Start with the ketoconazole shampoo. Along with, if among you have some problem, what you can do during the night time, you can apply the lotion. So you can apply any lotion of the ketoconazole or any antifungal, and you can wash it next day morning. So what it will do, it will reduce the fungus proliferation. Okay. तो सेबोरिक एरिया जो है वो बॉडी में यहाँ हर जगह पे हो सकता है. आफ्टर दिस स्कैल्प ऑन द आईब्रोज, nasolabial fold, axillary area and the perineal area. These all are the area which has a more sebum production, and because of this area in female below the breast, most commonly fungal infection you will see. In males, Dobby's itch or infection will cause this tinea, ringworm infection, right? So these all are the sebum secreting area of the body. Last topic, see, answer this. In India, which grass causes the dermatitis? Answer is a Parthenium grass. Second is the most common airborne contact dermatitis. It is a Parthenium only. Okay? Airborne contact means plants are on my border. So if you see this grass, see this, if you see this grass is extensively seen in villages. If you visit any farm in India, you will see this grass commonly. What is happening? The farmer is working, but sometimes the pollen from these flowers or is coming in contact. So it is a not direct constant contact, but an airborne contact. Okay. So ABCD. What is ABCD? It is a airborne contact dermatitis. It is a airborne contact dermatitis. Airborne contact dermatitis. It is a combination of type 1 and type 4 hypersensitivity reaction. Allergen. It is known as a Congress grass. It is known as a Parthenium hysterophorus. Congress grass or the Parthenium hysterophorus. It is the commonest cause of the plant dermatitis. It is the commonest cause of plant dermatitis in India. It is the commonest cause of plant dermatitis in India. So tomorrow we will start by 11. Okay? By 11 we will start. And what I want is, please, you will get enough time to read today also and tomorrow in the morning also. So what I want is, you have a quick bird eye view of this topic. Okay? And what I have seen, first of all, 1 minute. What I want to tell is, first of all, I'm looking at you guys. You guys look panicked.